You know, has a tuition of about 40,000-50,000 pesos, I understand it, every semester. Okay, we're double that.
Yeah.
And but we're not the most expensive medical school. So one of the things that I've realized very quickly here is that there are students who come into the Ateneo who have been accepted, meet the academic qualifications, but don't have the money to study. And so we actually support them through scholarships. Every year we raise about 7 million pesos in scholarships to support the scholars here. And the scholars number about 10 to 15% of the student population. Okay, that's a figure I can cite now. We would like to increase that number. And of course, secure the amount of resources to keep these students in scholarship. So that's one thing that I'd like to strengthen. And then, of course, the other thing is, I think, strengthening the research capacity within the medical school and among the students. We have to create certain research infrastructure here that can provide a core for a research agenda that is implemented by the faculty as well as by the students. And this has to be done in collaboration with other professional schools of the Ateneo. In fact, it's a topic that is being discussed at the level of the Board of Trustees. I think it's important that as an academic institution, we have a very strong base of research, because that's the way you expand and validate the knowledge. That's the only way you can establish best practice. That's the only way you can have a cutting edge towards scientific endeavors. If you don't have research activity, you're essentially just recycling current knowledge.
Yeah.
You don't break new ground. You don't open the door for innovation. You actually have little currency for interacting with other universities that do research. So that's another major area that I'd like to strengthen. And of course, the third area is the general operations of the school, from the teaching activity, from faculty development, all the way to the financial operations. It's strengthening the school as an institution, because it's a very young institution. It was established in 2007, so the concept of developing an outstanding clinician, a dynamic manager, and a social catalyst is actually workable. A number of them, I think about 10, maybe 15, are entering clinical residency. The rest have joined a whole different variety of institutions. From government, we have graduates who have joined PhilHealth, Bureau of Food and FDA, Department of Health. We have some graduates who have actually joined UP, National Institutes of Health. We have graduates, I think, who have joined local government. If you're a traditionally trained physician, you would not see it as an option, because you come out of medical school mainly with the clinical skills of a physician. And so going into a public health institution may not immediately be relevant for you. Okay, so that would be the big difference, because here the students are actually trained so that they have very good grounding in public health. In fact, they do community projects and research projects that strengthen their public health expertise. And then because of the MBA, they also do a strategic management paper, so that they can apply many of the management principles in their work.